I lead three elements in our presence in Africa, which is policy, and policy is highly focused on us providing very clear data and evidence of our socioeconomic elements of disease areas, and right now focus on breast cancer, so that the political space realize that prioritizing this is for the benefit of not only the social capital, but the economic valuation as well, and how we try and advocate for legislative framework change. For example, right now, over the weekend, we had the cervical cancer elimination uh, day on the 17th of November. How do we do this for the rest of the cancer? So that is part of the legislative framework dispensation in the countries. And most importantly, which was very focused in the London Global Cancer Week this week, is how do we ensure that there's sustainable financing mechanisms so that cancer is one of the disease areas that is focused in the universal health coverage. And from a population health lens, when all these things are done properly and well coordinated, how do we ensure that outcomes for patients, and again for breast cancer in Africa, how do we improve outcomes along the way if the system-wide approach is adopted? And the last element is health systems shaping, and which is a very big element of the WHO 6 pillars. How do we ensure these 6 pillars that improve healthcare are well focused on in our work as Roche? We were discussing how do we tackle the disparities we see in cancer in Africa. And I think my position as head of all these elements in Africa, understanding how the system is shaped, understanding the political landscape in Africa, what are the specifics that we could focus on? Disparities in the sense that the outcomes are poor, but within the poor outcomes, there's also a lot of inequalities and inequities in how cancer care is delivered in the continent, on the continent. First element, and this is what we're focusing on as an enterprise in Africa, is how do we catalyze and orchestrate improvement in breast cancer. And why breast cancer? Because we know there's enough evidence that it's one of the disease areas that has a ripple effect on other disease areas in cancer at 6% level. Other NCDs benefit if you improve the breast cancer pathway. The second element of why breast cancer, we're focusing on breast cancer, is we know from evidence and data, as I mentioned earlier, a lot of maternal orphans as a result of breast cancer in Africa. And I think data from 2020 shows that 90,000 maternal orphans, and these were children who lost their mothers before the age of 18, was exponentially higher in these countries where we focus on. So if there was a single answer, where there's such disparities, I think is coordination. We don't have a very clear end-to-end coordinated path when it comes to cancers, especially in the low and middle income countries, a lot of which is in African setting. Patients do not have a very clear path from having a symptom to getting a diagnosis, to getting treated comprehensively and in a full package in a very timely manner. So if we are going to start changing the disparities, this is where I would encourage the system to start. Can we coordinate the pathways? Can we understand where the bottlenecks and the glitches are so that we start to save more lives? And I think the final element is we need to really look at the out-of-pocket proportion of patients in the poorer countries, because without domestic local financing, a lot of these elements is why the coordination does not really exist. So I think one element, and this is what I think the panel focused on, and they made sure it was a cross-functional, multi-stakeholder panelists, in the same way that we are talking about disparities, understanding from each stakeholder lens. We need to bring these efforts together if we have to achieve starting to tackle the disparities. If we are going to achieve positive milestones on these pathways, we really need to come together more proactively and not on paper. We need to come together on the countries in themselves. We need to ensure that entities working on diagnosis or screening or treatment proactively talk to each other and they're coordinated at the local level.